Hey everybody, my name is Emily and this is my first video blog. And the reason I decided to do this was because when I first started my journey looking for answers on the vertical gastric sleeve, I went to a lot of YouTube videos looking for answers, and of course, I'm sure if you were like me, you had 1,000 questions in your mind. And so this is just kind of my beginning and explaining just a short history about me. And then I'm also going to leave you with a list of questions that you might like to take into consideration when you go for your first consultation with your doctor or your surgeon. Um, so a little history about me. I've battled my weight my entire life. I've dieted on and off for my whole life. I'm 40 now, and I would lose weight, sometimes a lot of weight, and gain it back, and lose it and gain it back. The problem was never losing, the problem was keeping it off. I'm not a food grazer, I'm not an emotional eater, but I do eat large meals, and sometimes struggling with that um, intense hunger was the biggest problem. Um, I never thought that I would ever consider any kind of bariatric surgery. There's a lot of social stigma with it, and most people don't understand it, including me at one time. And so I continued the cycle of lose, gain, lose, gain, lose, gain. And about a year ago, I finally decided to just check into what my options were. And at that time, I was very interested in having bariatric surgery just to help me. It is a great tool. And so I looked into it, but my insurance at the time would not cover it. So my husband and I, along with our daughter, joined a gym, and we hired a personal trainer for 3 days a week, and we began working out heavily. And I was doing really, really well. In fact, my husband and daughter are still doing very well until I hurt my back. And I had been struggling with back pain for about 10 years. Sometimes it would be so bad that I could barely walk. And it would seem to get better after periods of long inactivity. And, this time I tore a disc and had a bulging disc in another place. And that wasn't really that big of a deal. And so I was wondering what was causing me such tremendous pain, not to be able to literally walk across the room without agony. And so my husband urged me to please go to the doctor, please go to the doctor. He'd been asking me for years, and I finally did. And through a series of several months and lots of tests, it was discovered that I have very significant facet arthropathy and degenerative arthritis in my back. I also have fibromyalgia, and the pain that I was having from my back was so intense. I was going in every few weeks for steroid injections in my back. I was unable to work out anymore. My metabolism had gotten so off kilter that I would have had to be on about a 500 or 600 calorie a day diet just to get this weight off, since I could not exercise. And that wasn't an option for me. I was starving. And so my husband said, why don't you look into the surgery again? Our company that I've been with for 15 years was acquired by a multi-billion-dollar company. And so we now had insurance that would cover bariatric benefits. So I started doing lots and lots of research and made the decision to pursue the vertical sleeve gastrectomy. I spoke with my doctor about it. He thought it was a good idea, a good option for me because I'm relatively healthy otherwise. I don't have blood pressure issues or heart problems or anything like that, although this surgery is okay in some of those cases. So I am 5'3". I weigh, at my all-time height was 259 pounds. I got down to 228 when I was working out regularly. I have gained back up to 244 when I went to meet my surgeon for the first time, and now I'm down to 239, just kind of doing some pre-surgery prep. So to get an idea of my build, I'm kind of a medium frame. This is me. You can tell I have a lot of extra weight. Got the big old badonkadonk. I carry most of my weight in my arms and in my butt and in my legs. I don't know if you can tell with my pajamas on here, but so I'm about a size 20 right now, and when I graduated high school, I was about a size 8 and 148 pounds. So the thought of getting down that low again is exciting, but I have a hard time wrapping my head around it. But the first time I went to meet my surgeon, I was so excited that the process was starting that I forgot to ask a lot of questions that I should have asked. And fortunately, their office has been phenomenal and has responded to all of my emails. I go to Dr. Robert Richard in Gwinnett at Gwinnett Bariatrics in Duluth. He also has an office in Northeast Georgia in Gainesville. And if you're looking for a surgeon, I highly recommend him. They're a center of excellence, and he is a leader in bariatric surgery. So I'm going to run down a list of questions that you may want to consider talking to your surgeon about. First one, and these are in no particular order, so I may kind of go off subject and then back again. But first one is, how many years have you been performing bariatric surgery? This would be an obvious question. You might want to ask, do you perform other surgeries or only bariatric surgery? What type of training have you had in bariatric surgery? You want to know if they are board certified, which they shouldn't be practicing if they're not. It's also a good thing to ask if they are FACS, which is a Fellow of American College of Surgeons. That's just a real nice thing for your surgeon to have. It's a great thing if they're a part of that. You might want to ask them if they also do body reconstruction after your weight loss. I anticipate that I probably will need some because most of my weight is on my legs and my arms. You can see my arms are really heavy. So you might want to ask if they do the reconstruction, if that's something that you choose to do later on, or if they have someone that they recommend for that. If you're getting the sleeve, you're going to want to ask them if they use staples, sutures, or both. My doctor does staples and oversews, hand sews with sutures, and also uses a tissue sealant, kind of like a super glue for tissues, as a third step. Because a sleeve leak is probably one of the biggest complications, potential complications to consider if you're thinking about having the sleeve surgery. And we'll talk about that in another blog. So you would want to ask them if they oversew the staples. If they use staples, you would want to ask them about the tissue sealant as well. You want to know what their complication rate is. There are a wide variety of complication rates across the nation and throughout the country as well. Internationally, they do this surgery too. So you'll see percentages that range all over the board, but you're going to want to ask your particular doctor what their complication rates are. You're going to want to ask them what their mortality rates are. Yes, there is a risk of death with any surgery. This one is relatively low. My particular surgeon has never had a fatality. You're going to want them to answer the question specifically, what is your sleeve leak rate? The national average ranges anywhere from 2 to 8% from what I can best judge. My doctor's particular sleeve leak rate is 0.5%. If you have a leak along the staple line of your new vertical sleeve stomach, that can potentially be life-threatening, so it's important that you know what their sleeve rate is. It speaks volumes as to how well they do this surgery. You may want to ask how many trocars will be used for your surgery. The trocars are the little things that they put into your stomach. There's usually about 6 or 7 of them. Some doctors use 3 to 5. It just depends on the surgeon. One of those trocars will be inserted to inflate your abdomen with carbon dioxide gas so that they can see inside your stomach. Another trocar will be used to insert a liver retractor, which will go into your abdomen and pull your liver back so that they can operate on the stomach underneath the liver. Other trocars will make a way for the surgical instruments to be installed. And then, of course, a camera. So you're going to want to ask how many trocars will be used, and that will tell you how many incisions you're ultimately going to have. Most leaks happen at the top or the bottom. So you may want to ask them if there are any extra measures taken to protect against that happening. Some doctors leave in a drain to drain excess fluid from the body after surgery. My doctor does not use a drain, but many of them still do. So you may want to ask them if they use a drain or will leave one in that you'll have to have removed several days later. You want to ask them if they are going to put you on Levinox or heparin or other blood thinners after surgery. This is because with any surgery you have a risk of developing blood clots, particularly with hip and knee surgery are the most common types of surgery to get a blood clot, followed by abdominal surgery. So since you are having surgery on your abdomen, you're going to want to take precautions against those blood clots because that can be life-threatening. You're also going to want to make sure that you move around a whole lot after your surgery. Walking and getting around and moving will help to prevent that. So I want to ask them about blood thinners. You're going to want to ask them what types of compression devices they're going to use on your legs to prevent blood clots. Most doctors will put on a compression sock or hose followed by a compression sleeve that wraps around your leg and it inflates with air similar to a blood pressure cuff. This helps to stimulate circulation in your legs to prevent those blood clots. You're going to want to ask them if you have a hernia, if it will be repaired during surgery. Most doctors will repair a hernia once they're in there. If they see it, they'll repair it. If you have a lot of indigestion or acid reflux, chances are you may have a hernia. You can also ask if they will remove your gallbladder at the time of surgery. Some doctors, I have heard, will go ahead and remove the gallbladder because the chances of it going bad, for lack of a better word, after extreme weight loss are pretty high, so they'll go ahead and remove them as an extra measure just to prevent that in the future from happening. Or if you're having gallstones now, they may go ahead and do it. So you may want to ask them about whether or not they do that. Another question that's kind of controversial, and some people say it doesn't matter and some people say it does, is ask your doctor what size bougie they use, or some people call it a boogie, but it's spelled Bougie. And what that is they're going to put this tube down your throat that's about the size or diameter of a Sharpie marker, give or take a little bit. And that's going to go down your throat into your stomach, and then that's what they're going to guide their stapler against to cut the excess stomach away. And that just keeps them from cutting too much off. Bougies can range in size from 32 up to 40 and above. Most surgeons say that they recommend between a 32 and 36 is the most commonly used. My surgeon is going to use a 34 French bougie. It doesn't make a whole lot of difference. You can do a quick internet search, and I'll try to put the video or picture in the video after I make this to show you the different sizes relative to the bougie size, and you can kind of get an idea that there's very, very little difference. Some doctors say that the smaller the bougie, the greater the chance of complications. Some surgeons say the larger the bougie, the less restriction you're going to have, so they don't want to go too big. So it's just a matter of preference with your doctor, and you may want to ask them about that, and they can fill you in. You want to make sure, you want to ask and make sure, in my opinion, that your doctor is associated with a center of excellence. That just means that center of excellence doctors and hospitals have to exceed national standards in order to get that accolade. It means that they have the least complication rates. It means they work with the latest, greatest surgical equipment, whether it be robots or anything like that. So you just want to make sure that your doctor is associated with a center of excellence. That's really, really important, in my opinion. You want to also ask if they're a member of the American Society of Bariatric Surgery. You want to ask them specifically how many of these surgeries have you performed. If you're getting the sleeve surgery, you're going to want to know how many specific sleeve surgeries they've done. Not how many bariatric surgeries overall, but how many sleeve surgeries have you done. How many do you typically do in a year? You're going to want to ask them how many nights you'll be in the hospital. Most people are just there for one night, maybe two on the high end, but 1 to 2 nights is standard, so you're going to want to know from them how long you'll be in the hospital. You're going to want to know if their facility, or what kind of support that facility offers for after surgery. My particular surgeon's group, they offer free life coaching classes, they have support groups, they have massage services, they have personal training services, they have a free clothing exchange, they have protein supplements for sale. I mean, it's all there. And so you're going to want to be connected with someone who can provide you a lot of support. If you are going out of the country to get your services, your surgery, you're going to want to ask them to point you in the right direction with a local support group that you can be a part of. Your long-term success is directly related to the type of support that you allow yourself to be a part of after your surgery. So you're going to want to ask them when will be your first post-op appointment and how often will you check in with them after that. My surgeon, I will have a 1 week pre-op appointment followed by a 1 week post-op appointment followed by 1 month, 3 months, 6 months, and then every year for the rest of my life. That's just to keep me on track, be accountable. If you go into this surgery expecting it to be a one-shot deal and a miracle, it's never going to work for you. You have to expect this to be a lifelong process, and that includes staying directly connected with your surgeon. So you're going to want to find out how often those appointments are going to be. We talked about this a little bit, but you want to ask if your bariatric center offers a clothing exchange for other patients. I don't think a whole lot of them do. Mine does, and I think that's just super cool. So those are the most important questions that I think you need to ask. Certainly you'll have some of your own, and I'm sure there are plenty that I've missed. But it's really, really important that you go in armed and ready. Take these questions, have them written down, take a pen, be ready to write down their answers. There's no way you'll remember all of their answers. Take the time to write them down. That's the point of your consultation, is to sit down and take the time that you need to talk to your surgeon. It's really, really critical that you go in with as much information as possible. You will have less complications and you will have greater long-term success with the more knowledge that you have. So it's really, really important that you do that. So I appreciate you all watching this video. They won't always be this long, but since this is my first one, I wanted to just kind of give a little history about myself. And if you have any questions or you want to message me, that's fine. I also have a blog. It's Emily's Gastric Sleeve Journey.blogspot.com. Again, Emily's Gastric Sleeve Journey.blogspot.com. Feel free to follow my blog. I've got this particular list of questions on there, as well as some other good information that you might like to have, and just a little bit more about me. So I hope you're all having a wonderful day, and we'll see you next time.